Hi, it's a pleasure to be with everyone today. My name is Dr. Layla Azam, and I work at the Medical College of Wisconsin as a research scientist in the Department of Emergency Medicine, mainly with a professor that leads research also in Muslim health equity work, Dr. Asim Padilla. And so I'm working with him as one of his research scientists. I am a Muslim American Palestinian covered woman. So as you can see, with my visible identity, these are all a part of a compilation of all of my identities of who I am today, and who it's central to me. Thinking about faith, though, faith is the strongest and is central to me in terms of my personal and professional identity. And so when I think about my heritage and my background and bringing in my cultural religious background as well, makes it all a part of who I am and the work that I do. When I think about Islam as a religion, and then I'm in the public health field and healthcare, those values align. And I feel so strong about both because they're rooted in social justice and equity work. And so growing up as a Muslim, I've had many experiences and circumstances that made me want to advocate specifically for the Muslim community. Unfortunately, with all the anti-Muslim rhetoric and sentiment, it's in the US and globally, this keeps driving me towards, this type of work and into this area. And now I would say my main work focuses on advancing diversity, equity, and inclusion, specifically in healthcare, and also thinking about improving, health and healthcare through religious accommodations and cultural values. So this is how I think about it from that aspect. But there are so many facets. So I think about that healthcare touches, there's colleagues and staff and patients and so many people that are all part of the healthcare system. And so, I think about when the research that I do or the work that I do and how that's going to touch, whether it's educational or mobilizing like policies, that's what I try to do in all the work in the different areas. But I wanted to bring up actually a very important topic that's coming up in the month of March. and Ramadan is coming up. So that's the month of fasting for Muslims. And it's from sunrise to sunset, and thinking about no food, no water. It's a spiritual journey, but it's for 30 days. And there's a lot that comes with that as well. And there are special nightly prayers. So thinking about that month that's coming up from like a religious accommodation standpoint, and thinking about your colleagues or so I'll talk about patients in a minute, but if you've got colleagues or supervisors that would like to then accommodate individual work schedules, possibly, ask if anyone is requesting shift changes because of the timing of when they break their fast. Also thinking about, maybe they might ask for a lighter duty depending on how, things are going. Just even honestly, just checking in, thinking about when you have meetings, if everyone around you is eating and drinking, just being mindful and respectful. A lot of times I'm like, oh, it's okay. I know I'm fasting, but I'm fine. But thank you. I just appreciate that people will ask and care. And so from a patient standpoint, though, if you're a clinician, a healthcare worker, keep in mind that you'll have patients that'll be fasting or might want to fast and then have questions around their disease management. So an example could be diabetes. That's a chronic condition that they might need medications for, or adjusting their eating times or habits. So just thinking about all of that when it comes time to then patient care. So that's just one example. I'm not going to get into all the religious accommodations and observations that Muslims practice, but I just thought I'd share that with you right now. And we do have a nice policy report that hopefully you can share with the rest of the group and the team. And then finally, I just, anything I can do with the Muslim community, I try to do that work as well, because they're understudied as a population. So if I can give back and do some service to the community and think about working with the actual Muslim community to understand how we can advance health equity for Muslims as well. So thinking about, for everyone, not just, Muslims, but for other maybe minority groups, whether it's from a racial, ethnic, gender, just thinking about everyone that could be touched in these different areas. I'd like to see a little bit more, hopefully, in terms of professional development. So it could be that's where there's more cultural sensitivity and bias training programs, that would help. Then it's for everyone in the entire health system. I know that could be challenging, maybe to get everyone through all those pieces, but if there's a way to actually, over time, get individuals to then really have this, just instill this cultural humility in them, to ask questions, to know who you are, just like, I'm doing, you're doing, you have this entire month of, ethnicity and heritage and who you are. I think that we can all start with ourselves and just self-reflect and know who we are. And then that will then help us then take care of others and understand where they're coming from, because everyone comes with their different cultural and religious backgrounds. So I think just, how will this impact then your patient care, your interactions with your colleagues, your supervisors, and everyone. So I know those are broad, but I think it comes down to being curious and being able to ask and being humble.